The chair recognizes the gentlewoman from Illinois, Ms. Underwood, for 5 minutes.
Madam Speaker, the trauma, disruption, stress, and isolation caused by the COVID-19 pandemic has greatly accelerated the mental health crisis facing our young people. I have seen this reflected in my own community. My alma mater, Neuqua Valley High School in Naperville, Illinois, has lost 2 students to suicide just this school year. And these are not isolated events. We are seeing the impacts of the youth mental health crisis play out in schools and communities across my district and across the nation. Lurie Children's Hospital in Chicago has seen the number of children admitted as a result of suicide attempts increase from 2 to 3 children per month to 2 to 3 per day. 2 to 3 children per day. There are now 3,000 children on their wait list for outpatient mental health care. This is absolutely heartbreaking. However, I find hope in seeing young people in my community stand up in the face of tragedy and demand solutions from their schools and government officials. They shouldn't have to do this, but they are organizing, participating in school board meetings, and writing and calling my office. I want them to know that I hear them and I'm fighting for them. This summer, I introduced the Child Suicide Prevention and Lethal Means Safety Act to invest in educating healthcare providers in evidence-based youth suicide prevention measures. And it's absolutely critical that we act immediately to address the growing unmet need for more school-based mental health providers. That's why I am fighting for the maximum possible funding through the Department of Education for the school-based mental health workforce in the Omnibus Appropriations Package. I'm inviting all members to join this bipartisan effort. And last month, I was proud to join Assistant Speaker Catherine Clark to introduce the Elementary and Secondary School Counseling Act to provide consistent, long-term funding to support schools in hiring more school-based mental health providers and meet the recommended student-to-provider ratios. As we begin another year of fighting the COVID-19 pandemic, we must target resources towards supporting the mental health of kids in school. As U.S. Surgeon General Vivek Murthy warned in his recent advisory on youth mental health, quote, "It would be a tragedy if we beat back one public health crisis only to allow another to grow in its place." I urge my colleagues in both the House and Senate to work together and across the aisle to pass legislation, including a fiscal year 2022 spending package that makes necessary investments in combating the mental health crisis facing young people. We must seize this critical opportunity to build better, safer, and more supportive environments for our young people to grow and thrive. Thank you, and I yield back.